working this morning. Okay. Is this where we left off? You remember? I think it is. Female. Girlie will know. Is this where we left off? Huh? Is that our last slide? I think it is. Huh? Remember the cryptocoidism? And I think this, or did we do this? We did that? Where are we? Do you guys out there in Zoom land know?
I guess that's the one because I don't have password.
Yeah, I believe that's where we had stopped off. I had
I-
marked it in my PowerPoint.
Thanks. Yeah, I thought so. Okay, next time we're gonna do female development. In 35 seconds. Okay. We might finish this up today, maybe. I think. I don't know, we'll see. Well, today or Thursday. Today's Tuesday, isn't it? Yeah. Okay. Okay, well, that's it. Good morning, everybody. Today is Tuesday, April 27th, 2021. It is now 11 o'clock, and you guys are biology 1160, section 2. And last time we finished up the digestive system and started the reproductive system, and got a little ways, and then I think we got to here. At least that's the main consensus anyway. We got as far as female development. So what do we have to say about this? Let me get my laser here and let somebody in there. Okay. Okay. Oh yeah. Yeah. Remember how I don't know if I did talk about this, about how everything, I got a page, let me pay. Yeah. When we were talking about the male sex determination and development, talked about male and and the the female, I remember early on in development, both sexes here just like 6-8 weeks, look pretty much the same, and you don't really have anything that's differentiated until around 9 weeks or so. That's when things kind of start to differentiate. But it's under the testosterone that actually allows for the changes that you see take place in the male. So here I tell you the female reproductive tract develops because of the action, not because of the action of female hormones, but because of the absence of male hormones. In the absence of male hormones, the phallus, remember right here, becomes the clitoris. See how everything's color coordinated, and you can see homologous structures. So the glands penis and the glands clitoris are homologous structures, okay? And likewise, the urogenital folds become the labia minora, and we'll see that contributes to parts of the male penile urethra and so forth. And then the labial scrotal folds become the labia majora, and likewise homologous to the male scrotum. Internally, there's pairs of ducts in both sexes. In the female, the mesonephric ducts, or sometimes they're called the primordial ductus deferens, those degenerate. In males, of course, the ductus deferens they exist as, you know, the sperm carrying ducts that carry sperm from the testes to the penis. The female has them too, but of course she's not carrying any sperm to any penis or whatever, but her mesonephric ducts, they're not used, so they degenerate. However, she does have a pair of ducts that are retained. There are paramesonephric ducts. The paramesonephric ducts, of course, again, both sexes have them, these kind of pinkish looking ones. In the male, they degenerate, but in the female, at least the distal portions of it fuse to form the uterus and parts of the vagina, and then the superior portions are retained as the uterine tubes or the fallopian tubes, okay? But of course, in the males, they don't have those. Development of the male is this where I am? Female development. Yeah. Development of the male in the absence of male hormones results in feminization. Although what you see here, is this where I am? Is this the right? Something doesn't seem right. I guess this is where I talk about that. Seems out of order for some reason. But what this is, I thought I talked about this in male development. Anyway. Development of the male in the absence of the male hormone results in feminization. What you're looking at here, this is actually three brothers. It looks like three women. Well, these are three brothers, three males that developed in the absence of testosterone, and so that's the effect testosterone has on the sexual development. It creates all the male secondary sexual characteristics. Now these three individuals they have an X and a Y chromosome. Remember I said that your gender is determined at conception. You know, you can't determine the sex of the individual up until around 9-12 weeks or something like that. At least that's when sexual differentiation is apparent. And those differences occur due to the presence of testosterone. But if testosterone isn't there, well, the development is just going to continue on to be like a female. And so here I tell you, in these individuals, although a small phallus may be apparent, the external genitalia and secondary sex characteristics are feminine. The testes remain within the pelvic cavity, and the uterus and the vagina are usually absent. You see these individuals, especially the older ones. See the makeup and the hairstyle. It's pretty old. Kind of looks like it's maybe from the 40s or something. But you can tell that they're living their lives like females. you know, because they have breasts and their physique is basically shaped feminine, but they are in fact 3 males, you know. They have testes, but their testes are still in the pelvic cavity. And you look the genitalia on a younger one there. This is the penis, and these are the labial scrotal folds that haven't fused really. Kind of looks like a female's vulva, kind of, sort of, not really. But this is sometimes called a pseudo-hermaphrodite, which means a false hermaphrodite. Because in biology, a true hermaphrodite is a species that has both gonads, ovaries and testes. And usually what happens in true hermaphroditic species, that when they encounter one another, they exchange sperm, and they both leave the encounter inseminated, like 2 earthworms. You know, 2 earthworms come together, you know, they're hermaphroditic. But these individuals are not truly hermaphrodites. They look like females with testes, you know, they're hermaphrodites. No, pseudo-hermaphrodism. And of course, like I said, this is due to the development in the absence of testosterone. For some reason, they didn't develop testosterone. Okay, now for the male reproductive anatomy. The testes, or witnesses, or the testicles. The structure of the testes, here I have that there's a white fibrous capsule called the tunica albuginea. That's just the connective tissue capsule that makes up the structure of the testis itself. There are connective tissue septa that divide the organ into 250 to 300 or so wedge-shaped lobules, like these little compartments or little testicular lobules. And then within each lobule, you're going to have 1 to 3 seminiferous tubules in which sperm are produced. So the sperm production or spermatogenesis actually takes place within the seminiferous tubules. Here's a photomicrograph of a seminiferous tubule from a testis. You can see it's a tube, you know, it's a hollow tube with a lumen, et cetera, okay? But remember we said that the gonads, they are endocrine-like organs, remember that? We said, what were endocrine-like organs way back when we were talking about the different types of glands? Said that endocrine-like organs have some kind of other primary function. Like the primary function of the testes would be to produce gametes, right? They are cytogenic organs. They produce cells, okay? But they have endocrine hormone-producing tissues, okay? And so that's what you will also find between and around and surrounding the seminiferous tubules. And so here I tell you, between the seminiferous tubules are clusters of Leydig cells or interstitial cells. And it's the interstitial cells or the Leydig cells where the testosterone is produced. Seminiferous tubule has a narrow lumen lined with germinal epithelium. See this from here to here. And of course, it consists of several layers of germ cells in the process of becoming spermatozoa. So like these would be the youngest cells here, and they divide and they mature. And so the cells that are adjacent to the lumen would be the most mature cells, okay? And what's going on in the seminiferous tubules is a form of cell division that we call meiosis. We didn't talk about mitosis and meiosis in here. I think to be able to register for this course is assume that you already know about cell division and mitosis and so forth. Well, let's just pretend you do. But I'm going to give you just a real quick reminder about mitosis and meiosis. Mitosis and meiosis are 2 forms of nuclear division of cells. Mitosis is the nuclear division that occurs in somatic cells. All the cells of the body, just cells are, you know, making copies of one another. But meiosis is the nuclear division in the formation of sex cells or gametes. And that's different because the daughter cells that are produced, in this case, sperm cells, although sperm cells are, you think, male, but they still call them daughter cells. But anyway, doesn't matter if you're making eggs or sperm, the end result is a cell, a gamete, with half the number of chromosomes as the somatic cell. And so that's what's going on here. These cells out here near the perimeter of the tubule have this, of course, in a human, they would be have 46 chromosomes, and then they divide until you have the actual sperm cells in the lumen with 23 chromosomes. And that's what you want. You want gametes with half the number of chromosomes, because when fertilization occurs, you reestablish that somatic number. You have 23 and 23 is 46 again. And so you have a new individual with 46 chromosomes. It's not identical to its mom. It's not identical to its dad. It's a new individual. And that's the whole idea, is to ensure genetic diversity in the offspring. That's why sexual reproduction occurs. But anyway, this is where it takes place, spermatogenesis in the seminiferous tubule of the testis. How about that? There's also another type of cell that you can find in the lumen called sustentacular cells or Sertoli cells, or sometimes they're called nursing cells, because these little cells, they're just kind of in there to protect and nourish, so to speak. They're promoting the germ cells and to promote their development. And so that's all kind of nursing cells. They kind of promote the development, that encourage, I guess you can say, the meiosis and the formation of the sperm cells. Okay. So these are all seminiferous tubules and their little lobules right there. And if you look, they all come out and they unite in this network of little tubules on the posterior surface of the testis called the rete testis. You see that? And that's just where they're all united, still inside the testis. Each testis is supplied with blood with its own testicular artery and drained by testicular veins. It's normal blood supply. And that's it. And of course, they themselves are contained within a scrotum. You see the word scrotum there? Scrotum means pouch. I guess it kind of looks like a pouch. The testes are contained in a pendulous sac. That's how I call it, pendulous sac, the scrotum. The scrotum is divided into right and left compartments by an internal median septum. You kind of barely see this kind of partition that occurs in there. Kind of separates the testes in their own little compartments. The location of the septum is expressed externally as the raphe. The word raphe means seam. You can kind of see this, well, right in here, you can see a little bit. There's actually 3 different raphe that are identified in the male. A perineal raphe, which is between the anus and the base of the scrotum, and then on the scrotum itself would be a scrotal raphe. And then on the ventral surface of the penis, can't really see it here, but you can kind of see it here, would be a penile raphe. So why do you identify this? Well, remember where it came from. Originally, the scrotum was it was formed from the labial scrotal folds. Remember, the labial scrotal folds in the female produce the labia majora, but in the male, they're hemmed together. That forms like a seam. So you can see an artifact of that seam in the form of that raphe. So there you go. That's, so I guess you could say the male's raphe would be homologous to the female's pudendal cleft or pudendal cleavage or vulvar cleavage, that sort of thing. Okay. A structure called the spermatic cord. The spermatic cords are kind of like sacs within sacs. You have 2 spermatic cords, you have 1 scrotum, okay? And so here, this one's kind of intact right here, and this one's kind of cut open. But it's like 1 spermatic cord here, 1 spermatic cord there. If you follow them, they pass up the back of the scrotum, then anterior to the pubis, and through the inguinal ring, which is the opening to a passageway leading to the pelvic cavity. The actual tunnel, so to speak, was the inguinal canal. And of course, that opens up into the pelvic cavity. Because remember, that's where they came from. Remember, there's a gubernaculum that pulled them to the outside. Now, they on this graphic, they don't show you, but if you looked up underneath here, where it says tunica vaginalis, which is this little pieces of the, or a portion of the peritoneum, but underneath there would be a little vestige of the gubernaculum, which in the females are round ligament. Anyway, there's that. The scrotum has 3 mechanisms for regulating the temperature of the testes. Again, this is why the testes are on the outside of the body to begin with. Remember, this is a mammalian thing. Only mammals have testes in a scrotum, right? And that's because mammals are warm-blooded, right? And so they're kept out there, and they're kept cooler than the inner pelvic temperature. I think I tell you, well, or I think I already told you that. It keeps about 3 degrees cooler. And so how does it do it? Well, there's a combination of 3 mechanisms. First, the cremaster muscle itself. See this reddish band here, and you can see it over there in the background here. And all this is cremaster muscle as well. And we talked about the cremaster muscle when we were talking about skeletal muscles. Remember, it was the hanger. It hangs and suspends something. Well, it's here I tell you, strips of internal abdominal oblique musculature within the spermatic cord. The cremaster muscle can elevate or lower the testes. And so in a cold situation, if it's cold outside, of course, they would contract and draw the testicles up closer to the pelvic cavity where it's warm. And of course, if it's real hot, they relax and allow the testes to be pendulous and swing and dangle down there in the breeze and keep cool. All right, so that's the cremaster muscle, which is skeletal muscle. And then there's another muscle called the dartos muscle. The dartos muscle, you can see just up underneath the skin here, see right there, is a subcutaneous smooth muscle. So it's not skeletal muscle, it's actually smooth muscle. It causes wrinkling and shrinkage of the scrotum in a cold environment. So that's just kind of another thing too to keep them warm in a cold environment. And then the third thing, this is probably the most profound, I would think, as far as a mechanism. The actual blood supply is really modified, associated with the testes. There's a pampiniform plexus. See all this blue, highly branching vessels there? That's the pampiniform plexus, or the modified veins. Here I tell you, it's an extensive network of veins that surround the testicular artery. It surrounds the testicular artery. It's not the testicular artery, it surrounds it, okay? Inside the spermatic cord, it keeps the testes cooler by acting as a countercurrent heat exchanger. Countercurrent heat exchanger. I have a graphic over here to kind of explain like what's happening during countercurrent heat exchange. If you have all these highly branching veins, which remember are carrying blood back into the pelvic cavity, from the testicle, but they're branching, and it says spreading the blood over a broad area. And so if any fluid that's hot and you expose it to more surface area, it's going to cool faster. So this blood is cool going back into the pelvic cavity, but it's adjacent to the artery that's coming down carrying hot pelvic blood toward the testis. So assuming it's like 37 degrees centigrade adjacent to this network of veins that's carrying cool blood, that warm blood will be transferred to the cool blood, countercurrent heat exchange, because you got blood going in, blood going out, and by the time the blood reaches the testicle from the testicular artery, it's about 3 degrees cooler. So here it kind of shows you going from 37 to 35 and so forth. Countercurrent heat exchange, pampiniform plexus, keeps the testes cool. Okay, so that's the testes. Now for some ducts associated with all this. After leaving the testis, the spermatozoa travel through a series of spermatic ducts to reach the urethra. Remember, that's where they got to get out, through the urethra. There are, you look in the back, just outside of the testis itself that are draining the ricci testis are efferent ductules. Efferent ductules arise from the posterior side of each testis and carry sperm to the epididymis. This coiled mass you see above that is the epididymis. And here, you can see epididymis here, and epididymis here is kind of a posterior view of the male pelvis, okay, behind the bladder. Here, to find the epididymis is a comma-shaped coiled tubule on the posterior side of the testis. Sperm remains stored here for 40 to 60 days and become reabsorbed if not ejaculated. So they're basically, your newly formed sperm is stored here. And like I said, after a couple of months, if not ejaculated, they're just reabsorbed. But they just stay there and they hang out, okay? They don't swim around or anything like that. Sperm don't swim and beat their little flagella, their little tails until after they're ejaculated, but they just kind of sit there and wait, you know. If they are going to be ejaculated, they are moved to this next series of ducts, the ductus deferens, or some books will call it the vas deferens. Same thing, vas deferens, ductus deferens. Ductus just means small duct. Vas or vas just means small vessel. In other words, deferens means sperm carrying. So these small sperm carrying ducts or vessels, they pass upward from the scrotum, travels through the inguinal canal and enters the pelvic cavity. During orgasm, peristaltic contractions drive the sperm from the epididymis through the ductus deferens to the ejaculatory ducts. So you're following up here and then inside, basically inside the prostate gland. And that's where basically as they continue inside the prostate gland, that they continue as the ejaculatory ducts. So here I tell you the ejaculatory ducts lie where the ductus deferens and the ducts of the seminal vesicles meet in the prostate gland. You can also see here these bluish glands here and here, the seminal vesicles. They have their ducts. And so everything kind of merges together inside the prostate gland, okay? The ejaculatory duct is the last of the spermatic ducts. When I say that, the last of the spermatic ducts, the things that are purely spermatic or purely reproductive, okay? Because beyond that, you're joining the urinary system. And so structures beyond the ejaculatory duct would technically be urogenital, shared by the urinary system and reproductive system, okay? So there we go. The male urethra, I just told you that is shared by the reproductive and urinary systems. And of course, that's unique in the male. Actually, the female's urinary system is unique, the human female, because in most mammals, the female's urethra and vagina merge as one duct, so to speak, and she has a urogenital orifice. But in human females, they're separated, and you have separate vaginal orifices and separate external urethral orifices. Anyway, the male accessory glands. You got sets of glands that now, this usually gives students trouble because there's 3 different types of glands, but if you count up the number of glands, excuse me, there's 5 different types of glands. There's two of them that are paired, so that's 4, and then 1 that's unpaired. But only 3 of the glands, a pair and 1, actually contribute to the seminal fluid. So hopefully we can hammer that out here. So here, 3 sets of accessory glands in the males. First are the seminal vesicles. That's these purple, what color is that, purple or blue or whatever right there? Those are the seminal vesicles. The pair pair, one of the pairs, the left and the right one. On they're posterior to the urinary bladder. So that's what you're looking at. This view is from behind the bladder. So you're looking forward. So these are the posterior surface of the bladder. And of course, if you can see, they're attached to the underlying prostate gland right there. All three of these glands, the left and right seminal vesicles and the prostate gland together, those three contribute to the semen. About 60% of the semen or seminal fluid, I mean, technically semen is seminal fluid plus the sperm that are swimming in it. But seminal fluid is just basically spermless. So the seminal fluid, about 60% of the seminal fluid comes from the left and right seminal vesicles. So you can say, well, say 30 and 30, okay? There you go. Then you have the prostate gland, which is right here in the same neighborhood. Remember, the prostate gland surrounds the urethra at the base of the bladder. And of course, that part of the urethra is called the prostatic urethra. Remember that? And so it's a gland. It also produces a secretion that contributes to the seminal fluid. Here I tell you, its thin, milky secretion contributes about 30% of the semen. So each of these three, 30, 30, and 30, that's 90%. So 90% of the seminal fluid comes from these three glands. And that's where students fall into this trap. And then they say, well, the remaining 10% must come from these other glands. Well, they don't. These last two glands that I'm going to talk about next don't contribute to the seminal fluid. The remaining 10% actually comes from the testes and basically the ductus deferens, each of those. So maybe 5% and 5%, so that'd be 100%. So what are those other ones? Well, the third different type of gland you see right here, these little ones at the base of the penis, those are the bulbal urethral glands. Bulbal urethral means like bulb, because this is called the bulb of the penis, and urethra means like opens up into the urethra. Like the eponym is Cowper's glands. Cowper's glands, bulbal urethral glands, same thing. Tell you that they're located at the base of the penis. They produce a secretion, a clear, slippery fluid. Now, the following is a standard textbook definition or explanation of their function and their existence, which I don't buy, and I'll tell you why in a minute. But your book will tell you that the secretion, well, here I tell you, it's not considered a component of the ejaculate. Rather, it lubricates the head of the penis during sexual arousal. In addition, the secretions neutralize the acidity of the residual urine in the urethra, which could compromise the survival of the spermatozoa. So that's the explanation of its function. Well, it's okay. There's some truth in here. That the truth is that this produces its secretion prior to ejaculation. So it's being secreted and deposited during sexual arousal. And it is true that it travels down the urethra and accumulates at the head of the penis. But as far as a lubricating gland, perhaps, maybe a little bit, but not so much. But the function of probably to clean out the penile urethra, because there might be some urine in there that might compromise the sperm cells. I don't buy that at all, because if you think about it, that little bit of urine that would be in there, it's not going to do anything to the sperm that are ejaculated, because if you think about where the sperm are headed, where the ejaculate is going to end up in the female's reproductive tract, which is pretty hostile environment, a lot more so than inside the urethra with a little bit of pee. In the female's reproductive tract, there's a very low pH, and so it's acidic. And so most of the sperm that are deposited in there get cooked, chemically cooked and annihilated right off the bat. That's why you have to produce so much sperm. And did I tell you all about this, about the experiment that the guys did to do male self-sterilization? Did I tell you about that story? Well, anyway, in a normal human male ejaculate, there's about, if you measured it, about 3 cc's or 3 milliliters of semen with sperm swimming around it. If you counted the sperm in normal ejaculate of that volume, has about 300 million sperm swimming. That's a lot of sperm cells swimming around, waiting to, each one of them wanting to, basically their job is to find the egg and fertilize the egg. And it only takes one sperm cell out of 300 million sperm, only one of them is going to fertilize the egg. So my gosh, why do they have to produce so many? Well, like I said, most of them just get annihilated right off the bat. So most of them are kind of just there to help neutralize the environment, because the ejaculate has a higher pH. Remember we talked about mixing high pHs and low pHs, and when you do that, you neutralize. And so that's kind of what happens. And so anyway, you're going to have some of them survive, but most of them die. Now, the story I was telling you about male self-sterilization, that there was these 3 Soviet reproductive physiologists, I guess is what they were. They were going to see if males could practice self-sterilization as a form of birth control by heating up their testicles on a regular basis. And so that's what they did. They designed these special chairs that were cut out, and they had a hole cut out in the seat that had like a bowl in there that would keep hot water. And so every day these guys would sit in this chair and soak their scrotum in this hot water. And it was an attempt to kind of sterilize themselves, because remember, that's why the testicles are on the outside of the body to begin with, to keep cooler. So what happens if they don't keep cool? Well, it reduces your sperm count. And so a normal sperm count is like 300 million sperm. If you have 60 million or less, I think 60 million, that would be plenty. You can do that. Excuse me. I mean, you could, make nations with 60 million sperm. No, but you can't. If you have 60, if your sperm count is 60 million or less, you're considered sterile. It's not enough. If you deposited 60 million sperm in a female's reproductive tract, there's no way all the sperm would die. You wouldn't survive. So that's what these guys did. It's sperm counts before and after. And so, 300 million, and then they soak their scrotums for about a week or so, and then the sperm counts dwindle down, and hey, it works. Male birth control. You can do it at home, but you have to continue this practice every day, because as soon as you don't, and the testicles are nice and cool again, the sperm formation returns to normal. So anyway, it was on TV. It was, I don't know, some kind of channel, some news channel. It showed the guys, it didn't, they were covered up, but it showed them sitting in their special chairs, just sitting there, soaking their stuff. But anyway, that was kind of interesting. So that's why your testicles are on the outside of the body. All right. So the penis, look at this. Look, I have the etymology of the word penis, means tail, literally means tail. And it kind of is, got a tail in the front and a tail in the back. You normally think of a tail in the back, right? But guys have a tail in the front. And this is a special implement or appendage that males have, of all species, if you're going to practice internal fertilization. All right, you have to have an intromittent organ. Intromittent means like to introduce or to implant, right? your gametes inside the female's reproductive tract for internal fertilization. So here I define it. The penis serves as the male copulatory organ. That's copulation or coitus or mating or some other colorful terms that you may have for it. Bumping uglies. What do you call it? Do you have a fun name for it? I'm sure you do. Anyway. But it's there if you think about it, and all this, how much fun we might have identifying this implement. It's basically just there to deposit semen in the vagina. All right. Structurally, if you look at it, of course, this is a sagittal section looking at the interior of the pelvis, and then you see the penis here. You look at it, about half of it is internal. The internal portion of the penis is called the radix. The word radix literally means root, like the root of the penis. And then everything you see beyond that or outside of the body would be the shaft of the penis. And then the head of the penis is known as the glans, which means acorn. Just, I guess it kind of looks like a little acorn. If you look at structurally, now this is kind of a unique thing too. I talked about this in lab. You may have, well, you probably have already, yeah, we already talked about this last week. Talking about erectile, and I showed some of my lab students the bones, the bacula, the penis bones that a lot of other animals have, but humans don't have a, despite what you might call an erection, there's no bone in there. In lieu of a bone in the human penis, there are erectile tissues to facilitate an erection, because got to have an erection to penetrate the female's reproductive tract. I talked about shooting pool with a rope. It doesn't work. Remember that? So anyway, how does it work? Well, these erectile tissues, if you look, there are blood sinuses in them. And you normally just blood goes in, blood goes out. But during sexual arousal, you have some of the sinus with the blood vessels constrict, and they prevent blood from leaving. So blood fills the sinuses faster than it drains. And as a result, it basically pressurizes the penis and causes it to expand and harden. There you go. There you got an erection. There's three different types or three columns, I guess, of tissue. There's the corpus spongiosum, which means literally spongy body. That's the center one right here, or in this cross-sectional view, you can see it surrounding the urethra right there. That's why they call the penile urethra also the spongy urethra, because it's all surrounded with corpus spongiosum. You see that? Here I tell you, it passes along the ventral side of the penis and encloses the penile or spongy urethra. At the base of the penis, it forms the penile bulb. See, it's kind of expanded right here. It's expanded on both ends. It forms the bulb on one end and then the glands at the opposite end, okay? And then I tell you, on a flaccid penis, one that's not erect, the glans is typically covered with a sheath of skin known as the prepuce or the foreskin. Most people call it a foreskin. Anatomy books like to call it the prepuce. And actually, there's a female prepuce, but it's not exactly the same thing. But here you kind of see a cutaway of the foreskin or the prepuce. And of course, this is the structure, the integumentary structure, that's removed during a circumcision. It's a popular Western thing to do. They do it in other parts of the world too, obviously, but most American males born in a hospital get circumcised, unless you were like my dad, who was born on the kitchen table. My grandmother gave birth to my dad at the kitchen table. You know, you don't get circumcised when you're born out in the country, you know, but most American babies are born in hospitals, and then that's normally when they would do a circumcision. You know, you don't want a circumcision with somebody doing it with a pocket knife or a piece of sharp metal or whatever, although stranger things have happened, right? But the practice of circumcision, you know, there's different reasons for doing it in different cultures and so on and so forth, but there is no medical benefit for it, you know, because they used to say that, you know, yeah, you got to have a circumcision to promote male hygiene, et cetera, et cetera. Mother Nature is never going to give you something on your body that's going to hurt you, you know. You know, you can have problems in other ways, but anyway, it's supposed to be there, and it's supposed to cover the glands during a flaccid penis, the one that's not erect, okay? Because most of the nerve endings are associated with the glands during sexual intercourse. But anyway, you can have it removed, and what you have in lieu of a foreskin is a circumcision scar. And but since it's you know, more people are in the know of as far as a foreskin in the sense that, you know, you really don't have to have it done. And most insurance, you know, health insurance companies don't recognize it as a necessary procedure and necessary surgeries, elective surgery, so they won't pay for it. And so that the parents are faced with, well, paying something extra. Well, I got to pay to have him circumcised. How much is that going to cost? You know, I ain't going to do that. He can keep it anyway. So there's more and more kids, at least in the U.S., where their parents are opting not to have their child circumcised, their male child circumcised, which is, that's fine. You know, your kid doesn't need to be circumcised. You know, and I went to school, and I'm sure some of you out there may know somebody that's not circumcised or whatever, but there's nothing wrong with it, you know. I had a friend in high school that he wasn't circumcised, but he wanted to be circumcised, you know. He goes, you know, because he kind of felt different than all his friends, you know. All his friends are circumcised, and he wasn't. And,
Is it all normalized?
huh?
I just did a paper on circumcision in my nursing class. And I feel like the United States is the only one that really normalizes it. And like, I read a lot of papers.
Yeah.
Off of like German.
Yeah, she's saying that like the United States is like one of the only countries that normalize it. And like I said, it's a Western thing. And, you know, we're basically expected to do it, you know, unless you're like my dad, born in the country on the kitchen table, you know.
Older people start getting, like, they're not circumcised, they get when they're older too. Because that's when the medical conditions start.
Yeah, that's another thing too. You know, when you're, all my boys, I have 3 boys, and they're all circumcised, and of course I was circumcised, and so on and so forth. You know, I had it done, you know, and you know, I don't remember being circumcised, and I know they don't remember being circumcised because you did it like right after you're born. But when you're 18 years old, like my friend in high school, he wanted to be circumcised. He wanted to be all nice and trimmed for his senior trip, you know, and he remembered that. He was cussing his parents up one side and down the other. Oh, why didn't you get me cut when I was little? And then that's another thing too. You know, I've had friends of mine that asked my opinion. You know, should I get my son circumcised? I said, hey, you know, that's up to you. You know, he'll be just fine. But you gotta think about this too. He's an American kid, and little boys, you know, when they go to school, you know, there's going to be a point in his little life, you know, when they're all, you know, got little dudes, you know, lining up at the urinal. They're all got the junk out and they're just whizzing away. And then there's going to be some kids making a double take at him and go, why'd your pee-pee look like a carrot? You know, it's all pointy looking, you know. I don't know. What's wrong with it? I don't know. You're kind of trapped, you know. It's, but it's just kind of something that, we do, but like I said, more people are in the know, I guess, so to speak. I think people are living with it, you know. It's, I don't care, whatever. It's just all, you know, like I said, it's cosmetic. But there are people that are like, you know, protesting this and saying it's a violation of this kind of right and that kind of right, and say it's cruel and unusual, and they're in Washington carrying, you know, their placards and signs say, we want our foreskins back, we want our foreskins back, this isn't fair, you know, blah, 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 blah. And so you can go out to Hollywood and have your foreskin reattached, so to speak. There is a reconstructive surgery you can have if you have been circumcised to have a new foreskin, which is pretty brutal. You know, basically what they do is right here is they take the existing skin, assuming this is circumcised, they take this existing skin, make a circumcision, cut around like this, and basically peel that skin forward, and then take the skin that's up here and pull it down and attach it to the back side of that. And so when your penis is flaccid, it looks like it's covered with a foreskin. You really have to want your foreskin back for that. That's pretty barbaric. But no, it's a legit thing. But anyway, there it is. Corpus spongiosum. Now, there's the other one, the corpus cavernosum here on the dorsal side of the penis. That's these two right here, or on the sides right here. All right, that's the corpus cavernosum, the cavernous bodies. At the base of the penis forms the crust of the penis, or crura would be singular. These that attach to the pubic arch. Okay. All right, so that's the male. Now the female reproductive anatomy, beginning with her primary sex organ. Remember, the primaries are the gonads, of course, the ovary. The female gonads are the ovaries, which of course produce egg cells or ova and female sex hormones. All right. The interior of the ovary is distinctly divided into an outer cortex. All right. You see the outer cortex. And anytime you have a cortex, you're going to have a medulla. The cortex are where you're going to see the developing germ cells, so to speak, with the eggs developing. In the medulla, the interior, that's where you can find blood vessels, major arteries and veins, basically in the center. So all the ovulation and everything occurs just at the edge, the outer edge. Each egg, when it develops in its own fluid-filled ovarian follicle. Of course, you see this progression of development of the follicle that takes place. It's basically like a little blister that forms. It accumulates. Remember, a follicle is a fluid-filled whatever. And in this case, an ovarian follicle, the fluid that's in there actually is called liquor folliculi, which just means the fluid of the follicle. Basically, interstitial fluid, it fills, and it ruptures. And it ruptures, and the contents of the follicle are expelled into the female's pelvic cavity. And that, of course, that process of expelling and releasing the egg is ovulation. That's ovulation. You can see the little ovulated egg right there. And then remnants of it exist actually as endocrine tissue, developing hormones and so forth. This is the corpus luteum. You'll learn about, hormones and the cycles and everything in physiology, I'm sure. I won't get into it in anatomy. But this is the corpus luteum, the hormone producing portion. And then just kind of the remnant scar tissue that's left behind is called the corpus albicans, which means the white body. But anyway, this happens monthly in one or the other ovaries, or sometimes both, but usually just one. And but it happens for a number of years in sexually mature females up until a certain age where, the ovary is overwhelmed with corpus albicans, and it's doesn't release eggs anymore. And of course, that's menopause, and that's a whole other thing. Basically, that's that. Okay. The ovary is held in place by ligaments. All kinds of different ligaments. I have there's an ovarian ligament. That's a ligament between the ovary and the uterus. A suspensory ligament, that's between the ovary and the pelvis. And then the mesovarian, which is a portion of the broad ligament, which is the pelvic peritoneum between the ovary and the oviduct. And you can see all these pointed out here. This is all part of the broad ligament here. It's a portion of the broad ligament. The ovary is supplied with an ovarian artery, ovarian veins, ovarian nerves, which travel through the suspensory ligament. You can see where, yeah, you kind of see it in there right there. Okay. That's the ovary. Now for the secondary sex organs or her genitalia, all right, there's internal genitalia and external genitalia for the female. The internal genitalia are the uterine tubes or fallopian tubes or oviducts. It's all the same thing. The uterus and then vagina, which constitute a duct system from the vicinity of the ovary to the outside. Ovaries right here. And then there's a duct work that leads to the outside because, make a new individual, you got to get them out here, right? So there you go. The external genitalia, which is collectively referred to as the vulva or the pudendum, basically everything you can see from the outside here, includes primarily the clitoris, the labia minora, and the labia majora, among some other structures associated with those things as well. A little bit more about the uterine tubes or the fallopian tubes or the oviducts. Fallopian, that's an eponym. That's why it's a capital F, named after an Italian physician / anatomist named Gabriel Fallopius. How would you like going down into history? That's your legacy. You're named after the female's uterine tubes or oviducts. A uterine tube, you look at the word uterine tube, it means a structure of the uterus. And in fact, that's what it is. Remember, if the paramesonephric ducts come together and fuse and form the uterus and the vagina, okay? So that's kind of structural. But oviduct is kind of a description because it means like the duct for the eggs. Now, you could say uterine tube or oviduct, but don't say ovarian tube. I've had a student argue that with me one time. An ovarian tube is the same thing as a fallopian tube. No, it's not. The ovarian tube describes a tube of the ovary. There is no such thing. A uterine tube describes a tube of the uterus. And in fact, that's exactly what it is. Or you can use Gabriel's eponym and call it fallopian tube. And there's some other fallopian things in the body that are named after him, but this is obviously the most common one and what most people call the female's oviducts, in humans anyway, fallopian tubes. Anyway, I tell you that they're canals about 10 centimeters long leading from the ovary to the uterus. Each has a trumpet-shaped infundibulum. You see that, the expanded part, the infundibulum, with projections called fimbriae, little fringes kind of sticking down around it. And then it narrows to an isthmus, right? And then, of course, then it opens up in this fundus. And we talked about the word fundus before when we talked about the stomach. Like you have a bulge like on the stomach called the fundus. Well, this bulge on the uterus is called a fundus too. Anyway, the walls of the uterus, or the walls of the tubes rather, are well endowed with smooth muscle. And it is extremely folded. It's extremely folded mucosa have ciliated cells. Of course, the ciliated cells, they're there to beat and direct mucus towards the uterus. And of course, there's help of muscular contractions of the tube to help convey the egg in the direction of the uterus. So it's all about getting a fertilized egg to the uterus so it can implant. Usually fertilization takes place in the uterine tube where egg meets sperm in here. And as it's traveling down, it's undergoing those early cleavage stages. Remember, you got like 2-cell stage, 4, 8, 16, morula, and then usually around in here, that's where you got your blastocyst stage. And the blastocyst stage, that's what's going to be attaching to the uterine wall. About the uterus. The uterus is a thick muscular chamber that harbors the embryo, provides a source of nutrition, and expels the fetus at the end of development. Expels. Get out! 9.5 months has been long enough. You know, so there you go, you expel it. Now, morphologically, it's somewhat pear-shaped with a dome superior end, the fundus, get it? And a cylindrical inferior end, which opens up into the vagina, the cervix. Remember the cervix, the word cervix means neck. So like the neck of the uterus, I guess you can think of it like that, or the cervical portion of the uterus. But typically this is what they refer to, this portion of the uterus that's opened up into the vagina. Of course, this is the region of interest for a pap smear. If you have a pap smear, it's or a cervical scraping. Pap, that's another eponym named after, I think his name is George or Jorge, something like that. Papanicolo, short, just Pap. I think he was that's an Italian name, I think, but he was an American physician that developed a screening technique for cervical cancer. And what you're doing, like before this screening technique, cervical cancer was the #1 cancer killer of American females, before this technique. And it just involves taking some cells from the cervix and preparing a slide, and the pathologist can recognize abnormal cells. And so you would grade the pap smear like 1 through 5 as far as abnormality of the cells. But the whole idea is for early detection. The key to surviving any kind of cancer is early detection. So this is an early detection technique, So there you go. Thanks to Jorge Papanicolo, looking at the cervix. All right. The uterine wall, look at it. There's 3 layers. Remember, there's always 3. There's 3 distinct tissue layers of the uterus. There's the perimetrium. Some books will call it the epimetrium. That's the superficial outermost connective tissue layer, or the serosa, the outermost layer. And then the middle layer, that's the biggest, thickest layer, myometrium. You have the prefix my, my, and that's muscle, right? And so this is the smooth muscle layer, the middle smooth muscle. Here, constituting most of the wall. The myometrium has bundles of smooth muscle fibers running in all directions, but it is less muscular and more fibrous in the cervix. Okay, the cervix itself is almost entirely collagenous, with collagen fibers. And then this is probably perhaps the most important layer, the deepest most layer, the endometrium. The endometrium is the mucosa and the site of embryo implantation. Of course, this is what, if a embryo implants in it, it's going to develop a placenta. So the endometrium will go on to form the placenta, okay? If that doesn't happen, the endometrium will detach. This is a human thing. Every month, a new endometrium grows, but if implantation does not take place, it detaches and it sloughs off. And of course, that's what a menstrual period is. The detaching of the endometrium. And when it detaches, it severs capillaries. And of course, you sever capillaries, that's where the blood comes from. So your period is a combination of blood and chunks of endometrium. I don't know if you ever examined menstrual flow up close. You can see there's some chunky bits to it. Anyway, we're not too close to lunchtime, are we? Right at noon, we're talking about chunky bits of menstrual flow. Okay. All right. The structure of the endometrium, it sloughs off and it grows back. How's that happen? Well, there's 2 layers, a superficial stratum functionalis, the stratum functionalis, or the functional layer. That's the layer that shed each menstrual period. And the deeper stratum basalis, or the basal layer, is the layer that regenerates a new stratum functionalis for the next cycle. Okay, so there's that. A uterine artery within the cardinal or cervical ligament arises from each internal iliac artery. Remember that? It gives off several branches to penetrate the myometrium. You kind of see over here on the side here, of course, the myometrium, the muscular portion of the uterus. And as you can imagine, very thick, muscular, very vascular, needs a blood supply. And there's your round ligament. Remember we talked about the round ligament? The round ligament attaches to the uterus near the uterine tubes and it corresponds in position to the male ductus deferens, but is actually homologous to the male gubernaculum. Remember, I talked about this round ligament. If you follow it out, it'll end up inside the labia majora. And this is what, and if a male, the gubernaculum, this would be the gubernaculum. It would pull the testicle out here and then embed it in the labial scrotal fold and form the scrotum. But since this is a female, it doesn't do anything. It just kind of stays there. But you could follow it out and you'll see that it kind of just disappears in the labia majora there. Okay. Of course, if you follow it, I tell you, it exits the pelvic cavity and contributes to the labia majora, the female homologue to the scrotum. Okay. Then the vagina. The word vagina literally means sheath. What does that mean, sheath, vagina? Well, the word vagina actually came from a word originally, that's what you called the cover for your sword, like what a soldier would put store his sword in a sheath. So that's what the anatomist decided to call this portion of the female anatomy a vagina, the sheath for your sword. How about that? Interesting. So what is it? Here I tell you, it's a muscular tube about 8 to 10 centimeters long that allows the discharge of menstrual fluid. Here, takes the romance out of it, right? Also serves as a female copulatory organ and the birth canal during parturition. So it's where babies come out. That's usually my my go-to explanation when I have children looking at my models in lab. What's that? What's this? When my boys were little, they used to come with me to my lab and Papa, can we go look at the models with boobs? I say, yeah. All right, come on. Yeah, I don't want to tell them no. And yeah, this is anatomy. And they point, what's this? What's that? What's that? And then they point, I wouldn't describe the vagina as, oh, that's the girl's copulatory organ. That's where babies come out. To me, it's a simple explanation. Get a little bit older, then we can talk about some other things. But yes, where babies come out. All right. So there it is. Here I also say that the vagina tilts posteriorly. It's kind of angled back like that a little bit, or I'm going to do like this for you guys at home. Tilts posteriorly between the urethra and the rectum. So that's important to know. So you got three things here. 1, 2, 3. It's always in the middle, kind of angled like that or like this, between the rectum and the urethra. And of course, the urethra, here I tell you, the urethra is embedded on its anterior wall. Although in this view, it doesn't look like that. And it may or may not be. This is completely separated. Some females, remember I said that in most other mammals, the female's urethra merges with the vagina. And then from that union out, there's a urogenital sinus. So there's just one opening for the urethra and the vagina. And so actually, if you look at the back of most animals, like a horse or a dog or a cat, and they have an anus and they just have one little hole right there. Well, that's a urogenital orifice. They urinate out of that hole, and then also kittens come out of the same opening. That's not humans, it's separate in most human females. Although you'll see stranger things. If many of you are going to go on to insert catheters in patients and so on and so forth. And you'll see, wow, that doesn't look like it did in the textbook. You might see one external urethral orifice, you might see two. Or sometimes they do open up in the vagina, you know. So anyway, this is what it looks like in the textbook anyway. The vaginal epithelium is a simple cuboidal in childhood. This is interesting. Simple cuboidal in childhood. But the estrogens of puberty stimulated to transform into a stratified squamous epithelium. That's what you typically have in the adult. Remember, you have stratified squamous epithelium in areas that are prone to abrasion. So if the vagina is serving as a copulatory organ, you know, receiving the male's penis, that would, I think, would be passed as an abrasive event. And certainly childbirth, having a big head, baby's head coming through there, would be abrasive. So you need a thicker epithelium. So, but little girls before puberty, it's not like that. It's simple squamous. But anyway, I also say that the epithelial cells are rich in glycogen. Bacteria ferment this to lactic acid, resulting in a low vaginal pH. Remember I was saying that this environment in here is hostile to gametes, to male gametes, to the sperm cells. That's why you have to ejaculate and include 300 million sperm, because in here you got all this acid in there from that fermented glycogen, right? And so you got to neutralize it. So there's only a few of them that survive, you know, to go on to find the egg. All right, the vagina opens into the vestibule as the vaginal orifice. Of course, you can see the hole, the vaginal orifice here, which may be partially enclosed by a thin protective mucosal membrane, the hymen, or the old books called the maidenhead. Remnants of the ruptured hymen may exist as hymenal caruncles. Caruncle means like little fleshy thing. Of course, you see that in this individual here. You see the orifice, the vaginal orifice, and little bitty bumps right around there. That's caruncles. Here it says annular hymen, just means a circular, intact hymen, no caruncles, no nothing. And then this says paris introitus, which means has given birth. And so that's one thing that would totally annihilate the hymen. You know, the hymen intact, caruncles, and then gone. So there you go. Why is it there? Well, again, it's there to enclose the vaginal orifice, particularly in a developing female's reproductive tract, to close it off, to protect it. But it has to be open to the outside world to allow for discharge, right? There are conditions where the hymen isn't open to the outside, and it's called an imperforated hymen. And that's, you know, creates problems in itself, because if you have a little girl that's developing and this is closed off, and when she does start her period, that flow doesn't go anywhere. It's just gonna be trapped inside her vagina. You know, and it's probably a few cycles are gonna go by before you suspect anything's wrong. And the one thing that's pretty obvious that does happen is that it creates like a bulge here, like a big purple expansion that it's sticking out of her vulva, which is basically backed up discharge that's been there for who knows how long. And you have to lance the hymen to discharge all that, which is quite a procedure. Anyway, you have to catch it in a bucket, I'm sure. Anyway, the vulva, that's their external reproductive. Everything you see from this view is vulva or pudendum. The word vulva comes from a word that means like to cover or to close, and I guess you're closing in or whatever. But the word pudendum, I thought this was kind of funny. The word pudendum means shameful. Her shame, don't look, her shameful area. So this is, you're looking at her pudendum or her vulva. Now, structures of this include the mons pubis, the labia majora, labia minora, and clitoris. Those are like external reproductive features of the female. The mons pubis, here I say it's an elevated integumentary ridge with a thickened layer of subcutaneous fat covering the pubic symphysis. So it's like this fatty pad, like above the two pubis bones. It's formed by the anterior union of the labia majora. Labia majora come up here and they kind of unite up here in the front. The labia majora, or labium majus, which is singular. There's a problem with that in my lab pictures. It was kind of misspelled, but anyway. I define them as two longitudinal integumentary folds that enclose and protect the mucosa between them. Medially, they meet at the pudendal cleft or vulvar cleavage. That's basically where they meet. This is homologous to the male's scrotal raphe. So, of course, again, remember you had labial scrotal folds that fuse and forms a raphe in the male. Of course, it's left open in the female. But we identify the cleft or the cleavage in the female. Okay, so there's that. Then the labia minora, or singular would be labium minus, are flattened longitudinal fold of highly vascularized erectile tissue covered with a stratum squamous epithelial mucosa. The erectile tissue that is enclosed within the labia minora is the same that's making up the male's penile urethra, or the corpus spongiosum. So you got corpus spongiosum in the labia minora. Okay. Medially, the space between them is the vestibule. This is that word again, vestibule. Remember I said every body system has a vestibule. And so the pudendal vestibule, or the vulvar vestibule, it's kind of difficult to say. So pudendal vestibule, I think, is a little bit better. Or here there's just a vestibule, is the space that's created between the labia minora. And we recognize this space because there's things that open up into that space, like the clitoris, the external urethral orifice, the vaginal orifice, and of course the openings to the female accessory glands. Then the clitoris is structured like a little miniature penis, except most of it is internal and it has no corpus spongiosum. It does not enclose a urethra, so there's no, like a penis encloses the urethra, right? But developmentally, it's homologous to the female, or to the male's corpus cavernosum of the penis. So the erectile tissue of the clitoris is just corpus cavernosum, the cavernous body. All right. Anatomically, it consists of an internal radix, like the root, like the penis, which attaches to the pubic arch via crura. Remember the male had crura as well, a crus. And then the exposed tip is the glands, but the glands, clitoris, again, it's not exactly homologous to the male's glands, penis, because remember, the male's glands, penis is corpus spongiosum. The female's glands, clitoris, is corpus cavernosum. So little differences there. Anteriorly, the gland's clitoris is covered with a mucosal hood, the prepuce, they call it. And I tell you, it's not homologous to the male's prepuce or the male's foreskin. Basically, what the female's prepuce is where the two labia minora unite above the clitoris. Forms like a little. So it's not like something that can be removed in a circumcision. However, there is such thing as a female circumcision. Definitely not an American thing, but they're in certain parts of the world, certain cultures, practice female circumcision, and that involves removing the clitoris and also closing up the vaginal orifice, allowing just for a small opening for just minimal discharge. So, oh my gosh, why would you do such a thing? And it's pretty brutal, and it's not done in a hospital. It's usually done in a tent with sharpened rocks or pieces of glass. And the whole idea is to make, they do this to young females like right at puberty or just before puberty. But so, give her time to heal up before she gets married. But the idea is to make a sexual encounter as miserable as possible. And I think that would be, without a clitoris and your vaginal orifice sewn very small. Anyway, that's that. Now, let's stop here. That's a good place to stop. Thursday, I'll finish the female accessory glands and the breast, and that'll be it. We'll be done for this whole semester. And do y'all know when your final exam is next week? Is it Wednesday of next or Thursday of next week? You'll just go to my courses and you look at the fourth exam. In the, on your my course, you'll see the date. I just don't, off the top of my head, but that's where you look. And of course, remember, you have to Zoom and all that other kind of stuff. But anyway, we'll finish up Thursday. So I will see you guys then. And good luck on your practicals. Y'all taking a practical soon? Thursday? Okay. Of this week.